Hi, I'm Tiffany London. Sorry I look like this. It's sleeting at our house. But for my end of my final exam video, um, we were asked to select a health issue of your choice. I find that the ACA is something very close to me because I agree with it and I disagree with it. The Affordable Care Act. I've wrote many papers about this Affordable Care Act in previous classes and this class. A few things I've written, I just want to kind of read them and share what I've learned. The Affordable Care Act, nicknamed to many the Obamacare, was signed into law by President Barack Obama in 2010. Obamacare gave millions of uninsured Americans health insurance, access to it, also to help pay for a portion of it to help uninsured Americans be insured. Let's see, it was to kind of help with, I think, revamp the Medicaids, and that is still an issue with people that have MCNA. This is the dental portion. MCNA, Delta Dental, Smiles. They're revamping the Medicaid program every day, and changes are to come in January of 2019. Insurance has changed quite a bit all the time. We will learn this too when we get out, as I call it, the real world. But we are learning all this background knowledge that will help us. There was a Graham Cassidy bill that was brought in to revoke federal funding for Medicaid and for Obamacare subsides that lower premiums. This actually happened in Maine. The Republicans in Maine actually voted against the bill earlier, which was like 2017. The new bill would revamp Medicaid without considering the repercussions. There's glitches in every insurance system, but with uninsured Americans, they weren't getting the health care needs that would be provided. You had a lot of people that couldn't afford health care on their own, so they were sick. And that also brings into, a deterrent of not hand washing. It's not good. You're sick, your over-counter drugs aren't working, maybe you didn't get the flu shot, you're spreading the germs. Maybe you don't practice good hygiene, but you're spreading germs because you don't have you don't have access to affordable health care. So therefore you're spreading the germs to everyone else, and they're getting sick, and maybe they do have health insurance, but they have to take off work. Everything is revolving back to you didn't have health insurance. You couldn't afford health insurance, but you got others sick. I'm not pointing the finger. I know I just did, but it all is a circle. Just like we've learned in all our different theories and everything else, Obamacare, Affordable Care Act, has its pros and cons. It gave uninsured Americans access to health insurance by paying a portion or paying the entire portion. But it also will penalize you if you don't have health insurance. Okay, maybe you're a household of 5 or 6 people. You work 2 to 3 jobs. The adults do. Still can't afford health insurance for everyone. Then you're penalized for it? Where is the democracy in that? There isn't. But can you literally make everyone happy? I don't think so. I mean, you can try all day long, but it's not going to happen. I'm not trying to ramage on, but this is something that is really close to me, like I said. You know, there was a book that Jonathan Cahn's The Untold Story of America's Healthcare Crisis and People Who Pay the Price. It tells a story about Americans who value healthcare but cannot afford to pay for it. His isn't offered through their employer. And these people work multiple jobs, like I just said, to stay above poverty level. How does Obamacare or Affordable Care Act help these people? Especially when the given statement is Obamacare has given millions of uninsured Americans insurance without financial assistance, or with financial assistance. How can you stand behind this statement when Americans are working multiple jobs and cannot afford health insurance? There we go again. You know, that was just another example, and that's back in 2007. That was before Obamacare in 2010, and there was already problems. There's been problems in the healthcare. It's not going to work itself out in one day. Rome wasn't built in a day. But I will tell you something. With everyone with their knowledge working together, you can do this. We can all get together. Every president since Franklin D. Roosevelt has tried to reform the healthcare system to develop entry to insurance coverage. Yeah. This came from James Monroe. He wrote a book about overcoming and obstacles in health insurance, but was a fail due to being published before Barack Obama was elected. But he did mention that. I made this statement: to repeal or stick with Obamacare, I feel like I'm peeling petals from a flower. I'm still going to stick with that. I feel like I'm billing, even with my own personal insurance through my employer, I feel this way. All the knowledge, everybody has their own opinions, but we're still reforming, and it's been going on since Franklin Roosevelt. Obamacare has its pros and cons. It gave Americans insurance that could not do it without. They wasn't given through their employer. They couldn't afford it. They gave them a discount. But there's still Americans that cannot afford it at a discounted route. So you have your ups and downs with this. But I wanted to share my knowledge and opinions about Obamacare. And I've enjoyed the class. Thank you.